You were appointed as Vigmed's new CEO. Can you briefly tell us about your own background?
I have about 20 years of experience within medtech. My formal education is civil engineering and chemistry, and I have a business degree in international management. I have worked in various companies within medtech, Boston Scientific, an American-based company, also Coloplast, a Danish-based company, where the last role I had before I went to Vigmed was head of distribution, all emerging markets, about 110 markets, with approximately 100 people referring to me.
How would you like to describe the company Vigmed?
Vigmed is a startup company founded in 2009, but with no real activities until late 2011. We are based on the history of Vigo and Becton Dickinson, which were operating a rather large set of activities in Helsingborg, but decided to turn down the activities and move them outside of the country in 2008 and onwards. So even if we are a startup and a young company, we have a lot of experience based on, let's say, the former activities on Vigo and Becton Dickinson. We operate within infusion and injection, and specifically within safety devices. The most common occupational hazard within healthcare is needle stick injuries, and our mission is to eliminate needle stick injuries through innovating superior products for these segments. We operate with a principle of controlled outsourcing, which means that we partner up with manufacturing partners and also with distribution partners. And in doing so, we have faster access to the market through distributors with more clout, you can say. And also, when we partner up with manufacturing partners, we have access to much more knowledge on manufacturing and by all means also less investments, which is of course important for a startup company. We launched our first products in 2014 in the summer, and we now have 3 different product lines in the market.
Vigmed has developed an action plan which will be implemented in Q4 2015. Can you tell us more about this?
We had a very ambitious plan for 2015. But during the year, we found that we got delays due to delays in manufacturing equipment, also delays in registration, and finally also we needed to do a slight design change to our safety feature. All this meant that our sales expectations were not met, and we actually had to invest a little bit more than anticipated in getting the right products to market. The consequences are that our burn rate is simply at the wrong level versus the sales that we are delivering, and we had to simply look at the organization and reorganize to adapt to reality. So we have had to say goodbye to a few valued employees, and in the process we have also managed to, even with fewer FTEs, to focus more FTEs towards sales.
As you mentioned, Vigmed has previously suffered from various issues which led to delayed product launches. Are all the problems solved now?
What we found was that the product design that we had initially, when we tested that in the lab and also with our pre-launch activities, we saw a product that worked. But when we went out broader with less focus on each account, what we experienced was that there are differences in the way you handle the products. So if you handle the product strictly as intended use, we don't have a problem, but we have to face reality, and reality is that there are a little bit of difference between how you handle the products. So we had a choice. Either we try to educate the world to use our product in a special way, or we adapt our product to cater to the actual way people use our products. And that was actually an easy choice. We had to adapt our products, so our engineers has now developed a solution where even in challenged circumstances, our safety feature works. So if you ask me, are we over any kind of trouble that might arise, we can say that all the known issues that we've had are addressed now. but of course we cannot say if there are other issues that turns up in the future. But we are very confident in the product we have, and the feedback we have from the markets are extremely good.
Vigmed will conduct a fully guaranteed rights issue of 57 million SEK. What will the funds be used for?
In a company like Vigmed, we need to do a lot of investment up front to actually harvest the value later. So we need this cash to actually drive the business towards positive cash flow, which we believe will happen in 2018. We have invested the lion's share already in our equipment, in our R&D efforts, but to build up a scale effect, you can say, on the business, we simply need money to drive that process.
You have updated your financial targets and are aiming to achieve sales of 150 million SEK with positive EBIT in 2018. How will this be done?
First and foremost, it will be done with products that we already have. So that would be clip products, swing products, and switch products. And it will be in markets where we're already present or where we can use the CE mark as the basis of registration. Obviously, we do have upsides and significant upsides outside of that, either taking our products to other geographies or to bring new products to market. But we believe that that will either take additional investments or it will happen after 2018 when we become cash flow positive.
You are in discussions with several players in the market who have shown interest in acquiring licenses or rights for some of the company's technologies. Can you elaborate more about this?
We have a very strong IP, especially for a company of our size, and the IP actually covers much broader product areas than where we are currently present. And our philosophy is, if we do not see that we will enter these market segments within the foreseeable future, then maybe it's in Vigmed's interest and the shareholders' interest for us to try to sell off IP or sell off licensing rights to these areas. We do not see this as a core activity, but we do see that there can be an opportunity for us to fund additional activities within the company.